Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Dr. Mitzi Joi Williams, and I am a neurologist and multiple sclerosis specialist, and I treat and care for those affected by multiple sclerosis. A woman who has MS and desires to become pregnant has to consider several things. The first thing that I strongly emphasize with my young patients who are of childbearing potential is to plan. Most pregnancies, or nearly half of all pregnancies in the U.S., are unintended. So I very much stress from the beginning, we need to have a plan. If you and your partner or your spouse are potentially considering becoming pregnant, we need to sit down and talk about it. And sometimes that happens with the first or second visit, depending on where they are in their family planning stages. Sometimes it may happen later, depending on where I start to see a person. So planning is important for several reasons. Number one, we really would like to see stability of disease if we're trying to conceive. And the reason that's important is because if someone has lots of new MRI lesions that could potentially cause symptoms, or if they're just recovering from a relapse, that may not be the best time to add an additional stressor to the body, such as pregnancy. Also may not be the best time psychologically if they're dealing with the ramifications of those symptoms and those issues. So it's important because we want to see stability of disease as much as possible. And oftentimes, if I see someone for a first visit and they say, Dr. Williams, we really want to become pregnant soon, I recommend that they do maybe at least 6 months on therapy so that we can make sure they're stable, we repeat some scans, and then as long as things are good, then we may consider what are the next steps for pregnancy. The other reason that it's important to plan with your physician or your healthcare team is because we have to think about disease-modifying therapies, and this is very important. Our knowledge as an MS community is increasing in terms of how to treat women who are of childbearing potential and women who are pregnant with MS. There used to be a time where we uniformly took people off of all medications while they were trying to conceive, and in some cases that had very detrimental consequences. For some women who have very active MS, they may have started to have relapses or started to have issues, and depending on the symptoms, that may have eventually prevented them from having a family if they weren't able to take care of their children related to those consequences. So now there's a lot of information that's emerging in terms of when to keep people on medications until they conceive, which medications are safe to do that, which medications may be safe to take during the first trimester, and which may be safe to take throughout pregnancy. And so that's a very serious conversation that needs to be had very early. And also we're learning more about effects of different medications on forming or developing fetus. So the reason, again, that we want to plan is that in many cases, there have been very healthy pregnancies that have resulted from people on disease-modifying therapies, but we rather be on the front end and be ahead of that than try to wait and figure out what's going to happen if someone's on therapy and had an unintended pregnancy. There are many concerns that I hear from my patients concerning pregnancy. Number one, is it safe to have a child? Number two, will pregnancy worsen my MS symptoms? And I generally tell my patients that most people do very well during pregnancy. There are some people with active disease who occasionally have relapses during pregnancies, and those can be managed, but many people do well. In fact, I actually had a patient who, I wouldn't recommend this, but managed her MS by getting pregnant. So by the time I saw her, she was on baby number 6, and she was thinking about a 7th, but she would have a baby, breastfeed, have another baby, breastfeed, and she did very well and was not on therapy. So that would not be my recommendation. But many people, I say all of that to say that many people do well and actually feel well during pregnancy. Other concerns that people have are if they will eventually have symptoms where they may not be able to take care of their children. And again, we stress that we try to monitor people very closely. Obviously, we can't predict what the future will hold, but there are many people living with MS who have raised children successfully and have done very well in that regard. There are many different concerns depending on the patient, but we certainly try to address those as reasonably as possible, knowing that we can't necessarily predict the future, but certainly with the effective treatments we have and with close monitoring, we're often able to achieve stability so that people can take care of their families and raise them successfully. I have many success stories of patients who had positive experiences during pregnancy with multiple sclerosis. One in particular that comes to mind is a young 20-something-year-old patient of mine who had been married for several years. She had been on MS therapy and was very stable, and she and her husband decided that they wanted to conceive. So we went through the process at that time of weaning her off of her medication, and essentially what we would do is they would start trying, and we would check in every couple months to see how she was doing, to see if she had conceived. And so we started to check in every couple months, and there was no baby. So at around 6 months, we repeated an MRI, and we had some new activity. And so unfortunately, we had to take a break and put her back on therapy. And then after a break, we were able to wean her back off. And fortunately, she was able to have a successful pregnancy after that. She did very well during the pregnancy, was able to breastfeed, and has a beautiful now 2 or 3 year old baby girl. And actually, we were actually pregnant at the same time when I was pregnant with my daughter. So that was another special bond that we had. So she was able to do that successfully, but we again monitored her very closely. When the plan wasn't working, we had to switch it up a little bit. But with that monitoring and follow-up, she has done extremely well. We are still gaining more knowledge about the effects of menopause in women with MS. One of the interesting things about MS, because it's so much more common in women, is that there have been many questions about the effects of hormones, the excess of this one or the lack of this one related to estrogen and testosterone, and how they are related to risk for MS as well as course of disease. So when women go through menopause, obviously some of their hormones decrease, and so it can potentially worsen some of the symptoms that we see related to MS. So very similar to what we see with stress, that some of the symptoms may overlap and people may feel worse during that time because if they're having hot flashes, we know that heat makes MS symptoms worse, right? So if people are having their own personal summers, as some of my patients call them, then they can have temporarily worsening of their MS symptoms. And if that's happening several times throughout the day, that can significantly worsen quality of life. So during menopause, we follow very closely along with our patients as well as with their OBGYNs to make sure that we're managing those symptoms to the best of our ability, and also to make sure that we're monitoring disease to make sure that those things aren't worsening during the course of menopause as well. I have many stories of patients living with MS who have gone through menopause, but one particular one comes to mind of a patient of mine who was in her 50s and began to come in with very distressing symptoms. Certainly she had symptoms of fatigue that was worsening and primarily started to have difficulty with hot flashes, and it was very distressing to her. Because it was affecting her quality of life. She was having other symptoms like insomnia, and so we were trying to figure out what exactly was going on. Fortunately, I was able to contact and speak with her OBGYN directly, because one of the difficulties with treating MS and having multidisciplinary care is that oftentimes everyone thinks it's the MS. So if there's a symptom that worsens, whether it's spasticity or fatigue, obviously something obvious like a hot flash, we can relate to menopause. But many of the other symptoms, people are often able to, they said, I went to my doctor, they said it was an MS, they said, come back to me. But fortunately, I had a relationship with her OBGYN, and we were able to kind of talk through the symptoms, and we were able to get her on an effective regimen of hormone replacement therapy. And it so significantly improved her quality of life. And it was just amazing to see that transition transformation, because prior to that, I had been seeing her very frequently because we were really trying to figure out what exactly was going on and what was related to the MS and what may have been related to premenopausal or menopausal symptoms. So again, it's very important to have that team. I often say it takes a village to take care of a child, but it takes a village to take care of MS in many cases. And it takes communication, and it takes having clear objectives and helping people kind of parse out what's going on and how can we effectively work together to manage the symptoms and treat it. The main thing that I want people to remember after watching this video is that MS, just like life, is a dynamic disease. People may have different symptoms at different points in time. They may or may not have different levels of disability, and the normal effects of life can affect multiple sclerosis. I think it's so important to be aware of your body for people living with MS, to be aware of your symptoms, to be aware for what is your baseline and be aware of what's different, so that you can partner with your healthcare team to make sure that we're treating things adequately. Sometimes in dealing with chronic diseases, people think that, well, this is just the way it is, that it has to be that way. And sometimes that is the case. But oftentimes there are things that we can do to make your quality of life better, right? We don't necessarily have to suffer when there are interventions, but if we as healthcare providers don't know you're having those problems, then we don't know that we can help you. So it's important to partner with your team, it's important to know your body, and it's important to reach out if you need help or if you're having new symptoms, and know that just like your body changes, MS can change. And so we have to change and adjust our treatment plan based on how you and your life experiences change over time.